And our final presentation for today is, I'm really excited. It's actually the first time we get a briefing from one of our advisory committees to this committee, one of council advisory committees to our city council committee here. So not long ago, my appointee to the Disability Access Advisory Committee sent me an email and said, hey, here's our annual report. We put something together. And I thought, well, that's great. I wish, I won't say I wish everybody did it because then we wouldn't have enough time for everything, but I thought it was wonderful and worked with her to see if someone could come give us an overview of that report. So we'll have a briefing by the Disability Access Advisory Committee. Let's see, including an overview of the purpose, accomplishments, and partnership with the Disability Access Office. So the memo says, sorry, the agenda says Roderick and then Razi, but I think somebody else is going to speak.
Yes. Madam Chair, we have Jose Martinez that will do the presentation today.
Yeah.
And Deborah, yeah, can you introduce yourself too?
Yeah, so I'm actually going to start him off. So I'm going to kind of fill in for Razi and Rod a little bit. And so my name is Deborah Sharvin, and I actually oversee the city's Disability Access Office. And so before I kind of introduce Jose to talk about the advisory committee, I just wanted to kind of talk a little bit and give some information about our office and how we connect with the Disability Access Advisory Committee. So if we can kind of go to our first slide, that would be great. All right, go ahead. There we go. So just to kind of give you guys an overview, our office has actually existed since 1978. And so our mission is simple and complex at the same time. And it really is to make sure that all of our residents, regardless of ability, can fully engage in our civic and community life. And we do this by making sure that the city programs and services are accessible and usable to individuals with disabilities. Next slide. So our office does this by focusing on our three core services, where we have this one service, which is really how we work to improve compliance inside our city. Our office serves as the city's coordinator, ADA coordinator and 504 coordinator of record. So we obviously partner with departments on any type of complaint resolutions, and we also partner with them on transition plan monitoring as required under the different laws and standards that we work with. But what we really do is we really focus on how we can get this meaningful use done throughout the city. And so our office provides technical assistance. So we actually run email and phone that anyone can call us, regardless of whether you're a city department, you're a public business person, or just a community resident. And we not only provide technical guidance and assistance on technical standards, disability, kind of some ADA awareness, things like that. But we also serve as a technical advisor to different departments as they're working on different projects and initiatives. One of the other things our office does is do design plan reviews. So not only architectural or infrastructure related in the public right-of-way, but we actually work with ITSD on digital design and digital accessibility as they're working on different projects and initiatives through them. We also provide staff training. We also develop different types of educational materials and guidance that either staff can use and sometimes the public, depending on kind of which situation we're writing for. But those two services completely lead into what we're trying to do. We're trying to advance equity and inclusion for people with disabilities. And so we do this by building partnerships, and we look at our community partnerships as both internal, how we work with other city departments, but how we're working with our community organizations. And one of the ways that we feel that we've been doing, that we're working and focusing on more, is how we can build these disability data sets that a lot of organizations need as part of their strategic and program planning. And so we're working on how we can also disaggregate this data based on race, ethnicity, and gender as we kind of move forward. But one of the strongest pieces that we do in how we advance equity is making sure that people with disabilities have a voice at the city's table. And so we actually serve as the city's liaison to the Disability Access Advisory Committee. Next slide. And so I'm going to go ahead and turn this over to the presentation to Jose Martinez. He is the chair of the Disability Access Advisory Committee, and he is an assistive technology trainer at the San Antonio Lighthouse for the Blind. Jose?
Yes, hello. Good afternoon, council members, and thank you for for inviting me to speak at to this committee. The disability community in San Antonio is a growing and diverse population with unique needs and abilities. The Disability Access Advisory Committee, or DAAC, was established by council in 1979 and serves as the city's connection to almost a quarter of a million San Antonio residents living with a disability. Our role is to advocate for people living with disabilities and provide city staff with possible solutions to the challenges our community faces every day. Our members provide the lived experience and knowledge so city staff can improve accessibility in city programs, services, and facilities. Next slide, please. I serve as the current chair for the committee, and Ms. Melanie Kaufman serves as the vice chair. Both city council members and the mayor appoint members to represent them in this committee. Members of the committee have an extensive experience and knowledge in the disability community, either as an individual living with a disability, or a family member, or a disability service professional. Our goal is to have a majority of members who are living with a disability and to have as many types of disability experiences represented in our membership. We currently have several vacant positions on the committee, and we would like to work with the individual council offices to ensure that these vacancies be filled as soon as possible. Next slide, please. The DAAC serves as a voice for the disability community, and does and in this role allows us to create partnerships between the residents, elected leadership, city staff, and the Disability Access Office. We believe in open communication, where we receive information and provide feedback so we can all work together to improve outcomes for individuals living with disabilities. Next slide, please. In 2020 was a unusual and challenging year for the entire community, and our committee addressed these challenges head on. We partnered with the Bexar County Technical Advisory Committee with persons with disabilities to address COVID response and recovery, these efforts. The two committees developed recommendation letters for city and county leadership to encourage budget and target planning goals and accessibility improvements to enhance access to opportunities and availability of health services and employment opportunities for people in the disability community. Our members also created a letter of support for including adult changing stations in new facilities, including, and then there was also a list provided for priority locations for potential stations as well. Next slide, please. In 2021, the DAAC will continue our focus on equity for the disability community. Our priority is to improve representation of people living with disabilities on city committees, boards, commissions, and working groups. And we would like to see the level of representation equal to our overall representation in the community. Members will focus on developing partnerships with the Transportation Department, the Economic Development Department, and the Parks and Recreation Department as well. Our third goal is to improve communication between our members and the council members we represent. We are currently, to work on that, we're currently developing a welcome and information packet for council members and staff. Next slide, please. The city of San Antonio has come far since our beginnings in 1979, but we still have more to do. I ask you, this council committee, to consider these ideas as you focus on city initiatives. Are people living with disabilities included in the planning and implementation of strategic plans, programs, and services? Are there targeted goals with projects for people living with disabilities? Are projects that help people living with disabilities prioritized? Does the city hire companies with employees or are owned by people with disabilities? Are people with disabilities represented on city boards, committees, or working groups? City programs and initiatives must be person-centered and inclusive of people living with disabilities. We must be intentional in our choices by bringing people living all types of disability experiences to the table, not only to hear their issues, but act on their solutions. And our committee is committed to being your partner in this process. Next slide, please. I, on behalf of the DAAC, thank the members of this council committee for your continued support of our efforts that will help and make San Antonio a leader in equity in the disability community. I invite all council members and your staff to attend one of our upcoming meetings. At this moment, if you have any questions or comments, Deborah and I are here and for those and to discuss those with you. Thank you.
Thank you very much, Mr. Martinez, for all your work on the DAAC and for being here today to provide this presentation. I just have some quick questions before I turn it over. Jose and Deborah, you know, the items to consider at the end of this presentation, I don't know if you could bring up that slide. These are great questions. How can we, I think some of these are some basic questions that we can ask. Would it be possible for the disability Access Office to help us get some of these questions or questions answered?
Yeah, I mean, that's one of the things that we can do. So one of the ways that we serve as this technical advisor to city departments and as groups are working on different initiatives is to either sit at the table and help them with kind of these accessibility and inclusion questions, but to also connect the disability community based on what their needs are. So for example, as we're working with ITSD on different accessibility projects, like the COVID portal that we released this year, we were connecting them with the different community members so they could help with user testing, so they could help provide feedback on that process. And so that's definitely something that we can do, and we can definitely connect with whatever initiative that the council would like us to work on.
Okay, well, I'll start with that, and then let's see what other questions we get from my colleagues here. So, Councilwoman Andrew Sullivan.
Well, thank you, Madam Chair, and thank you, Jose. Thank you, Deborah. So, one of the things that still weighs on my heart when it comes to the COVID response and the information being given is we have a lot of people that sign. And so I really don't know how they're getting their material, if they sign or if they're visually impaired. Are we sending it out in Braille? Is there a phone number specifically for those individuals to contact to get the information? So if you could speak a little bit to what that looks like.
So from our perspective, as we've been working with the offices and now how the DAAC has also kind of supported the different COVID response and recovery initiatives, one of the biggest pieces that happened was the partnership with the Office of Emergency Management, because we do have an accessible alert essay program that provides alerts in sign language with ASL interpreters. And it is completely compatible with Braille printers. So for the community that is deafblind, they can access that. And one of the things that we did with the Office of Emergency Management was provide community information throughout COVID-19. And so normally this type of alert system would be for what would be considered emergency alerts. You know, the tornado is coming, the flood is coming. But we had worked with them, and I'm going to say we did something over like 70 or 75. I'd have to go back and actually look at the final number on this is where you can go get vaccines. This is where, hey, did you know that you can get rent and mortgage assistance through this community portal? Did you know that you could call this number for utility assistance? This is where you can go get food with the food bank. So that was one of the ways we tried to do that. It's not a perfect system, but that's one of the ways that we tried to help that community and make sure that we were reaching everyone.
Well, thank you so much. And then as we're rolling out the information on the COVID vaccines, and how are we connecting our disability community to those vaccines? Is it by way of a text alert system as well, or are we using a different mechanism to get the information out about the waiting list and about the Alamo Dome or text?
So a lot of that has been kind of merged to what Dr. Bridger was talking about before, how different home healthcare agencies and different organizations were kind of getting funneled through the programs that they already had. So I can tell you that I've been part of the vaccine conversations and the different health conversations. And so we have been trying as much as possible to make sure that it kind of stays in that inclusive system. So there's not one number for people with disabilities, one number for the other, regular community members. And so it's been processed in that way. And if you need more details, I can definitely work on getting that to you.
Okay, awesome. I'd love to see that. I just want to thank Ms. Anna Lewis, who is our District 2 for the work that they have been doing. And I am looking forward to attending one of your meetings and seeing how we can truly be inclusive when we're talking about our parks, our trailways, and even economic development and housing. And so I'm looking forward to hearing that discussion and also seeing the report that Councilwoman Sandoval was speaking of. But those are all my comments and questions. Thank you, Madam Chair.
Thank you. And Councilwoman Viagran.
Thank you, Chair. Thank you so much, Mr. Martinez, for coming and briefing us and being a part of this, because I think it is absolutely integral. Thank you, Chair, that we finally were able to have our briefing from our advisory group. I'm very excited about that. And thank you so much, Deborah, for being here and all of your coordination. And yes, we understand that this committee has been here for a very long time, but I think we have a great opportunity as we move forward to really integrate this into not just conversation as a reaction, but being proactive as we're developing the policies. So I would be interested, Chair, that and David, not that I want the committee, the DAAC to always come to us, but as we're having the conversation of preparing for the next bond package, we're talking about all of these 6 categories, maybe more, when it comes to streets, infrastructure, drainage, housing, all of these different elements. I think that is important to have have our DAAC group come and inform, kind of like those questions to consider that he had on slide number 9, I think it was, to consider them to make sure that we keep this embedded in our policies as we're moving forward. And just so all of us can hear it at one time. I also believe it's important that we consider to make these items to consider when you're doing your budget goal setting sessions as well. When we're talking about increasing dollars to public health, as we're talking about public safety, as we're having the public safety town halls, that it's included and we have these built in to the conversation here. And as we're having the UDC conversations, that it's continuing to have these elements brought in and make sure that our partners in the many of our partners who work with us on talking about the UDC, talking to the chambers, talking to REXA, talking to SABOR and all of them, that we also share with them what our DAAC committee has and has approached us with, that we always keep that at top of mind. So to Councilmember Andrew Sullivan's point, yes, I believe that these are all integrated. They're all interwoven in every part of the city period. The story of the city, our departments of the city, and how we serve all of our citizens so that it is a good and safe and effective working place for all San Antonians of all abilities. Thank you very much, Chair.
Thank you, Councilwomen, for your comments. Mr. McCary, Deborah, do you guys want to tell us maybe what are some next steps on this?
So in terms of next steps for this particular subject, I think one of the things that we'll do is we took some notes, and as part of our takeaway, I think we'll get a chance to share it with Rod, as well as what's happening with our bond. But we also had some other steps that were taken away that I think was very critical, and that was with our boards and commissions. These are great opportunities for kind of leading the way as we move forward. But I'm thinking that we've got some more work to do, and we've done some great work. I do appreciate the Office of Equity and the conversation speaking to equity as it continues to move forward. So I'll probably have to go offline and get some details from his check committee, but I'm looking forward to trying to advance some of the information we shared today.
Mm-hmm. And I can tell you right now that we have been in conversations with the city clerk's office. I know that there's a new potential process coming online soon related to boards and commissions and application processes. And we have been in that conversation about how we can add disability as a demographic question in that optional piece, so we can help track that conversation a little bit better, as well as you guys can make better choices or more informed choices as you guys get those applications and review those.
Sounds great. All right. Well, thank you all very much. That concludes our meeting for today.
Councilwoman